Thank you, Godfrey. Summer is just about done and it's almost back to school. And what does that mean? We need to check on your immunizations for your school-age children and yourself. Here to talk to us about this, we have Dr. Teoria Murray. She is a medical officer with the surveillance unit. And we also have Gina Rose. She is a nursing officer and a national immunization coordinator. Good morning and welcome to Bahamas at Sunrise.
Thank you.
Good morning.
Thank y'all for being here. Y'all ain't got no needle in the studio with y'all, because I'm scared of needles, right?
Not today.
I was telling y'all before that I got a needle when I was a child, and I mashed up the whole doctor's office. Shout out to Dr. Roberts, may you rise in power. But I broke his office up from top to bottom. I climbed all over my mom, knock everything off the counter. So let's go dig right in. Why are vaccines important for children?
Okay, well, we know that our bodies are really wonderfully engineered. We have our natural immune system, right? So that when we encounter viruses and bacteria, our bodies are able to mount a response, produce antibodies. Now, babies, their immune systems are not fully developed yet. Initially, they have that protection from their mom's antibodies, but that wears off. And so what vaccines do is they teach the body to be able to respond to these viruses, these bacteria, and protect them from getting the actual disease, so they can get the antibodies without having to get sick.
It's like they're training up those special white blood cells to attack that special disease, getting your army all built up. Are the diseases that vaccines prevent, are they still prevalent today, or are they phased out and we're just taking them for taking its sake?
Right, so it's easy for us to take that for granted, right? Because people will think, oh, I don't see measles, right? I don't see mumps, we don't see these things, polio, those are things of the past. Like what is that? We don't even, like, people don't even know. But the reasons that we don't see them is because the vaccines are there to protect us. It's like armor, right? So the arrows are still being shot, but you have the armor, so we're not seeing the effects of the diseases. But illnesses like the polio virus and measles and mumps, they're still out there. And thanks to vaccines, we don't see them manifested, so it's still important for us to be protected.
So what vaccines are needed for school-age children? Once again, I remember getting measles, mumps, rubella, and maybe a couple other things when I was a child. But has that changed, or what do children need now?
No, so that has not changed. So just to piggyback a little bit on what Dr. Murray would have said, even though we don't see those diseases in the Bahamas, and like she said, they're still around, so there are places that we like to go. We like to go to the U.S., and some of us like to go Canada, and some of us like to go to the Sahara. And so those places, those diseases exist. And so you want to protect yourself and your children, especially if you're going to frequent those places. And then we do have people that are coming from those different countries to our shores. Millions of people already for the year. And so the vaccine is a way of protection and prevention. So for the children who are going into school, so primarily our grade 1 students, they should have by now had already have 2 doses of their measles, mumps, and rubella vaccine. And we usually give those 2 doses between age 1 and 2. By now they should have already had their polio drops, and it's about 4 doses of that by grade 1, and they should have also had what we call the DPT Hib Hep B, and should have already had 5 doses of that vaccine as well by now. We also have started giving children chickenpox vaccine, so you don't have to get the bumps and the itching, and need the calamine lotion.
That's a rite of passage.
Why? And the scars that remain on the face. Right. So we give chickenpox vaccines now to prevent that from happening. And so by that age, they should have already had 2 doses of that particular vaccine as well.
So I remember having the little card that you had to go take to school and give to your principal. Is it still a immunization card that you carry around, or has it changed? How do we keep track of our
Most
vaccinations?
definitely, yes. So there is still a yellow card, immunization card that the parents would receive from your healthcare provider that will show the record of every vaccine that we would have given to them. And that is a requirement when you're going into school, particularly for children grades 1, 4, 7, and 10. They should submit their immunization records so that the school and the school nurse would know that they would have been vaccinated and been brought up to date as they go along. So yes, there is a card that still exists.
There you go. My memory ain't that bad, right?
No.
So excuse me, is there a case where somebody is not able to take a vaccine or shouldn't take a vaccine? I mean, is there a medical condition? If, let's say they haven't taken, let's say, these vaccines as a child. Can they still go to school? Or are they barred from public places? What happens if you choose not to, let's say, immunize yourself or your children?
Okay, so I'll take a piece of that, and then you could have the rest. But Vaccines are a requirement, yes, for school, and there are some legal conditions where, let's say for religious purposes, you choose not to immunize the child, then that should be documented and presented to the school as to why not. We do have some children who may be what we call immunocompromised, and certain things they cannot take, or they may not take them on the schedule as other regular children. And so if that's the case, then a note still should be provided by their physician to say, okay, well, this child has X, Y, and Z and cannot take the vaccine. Very rarely, though, you do have some people who might have started and taken a shot and had an allergic reaction or severe reaction. And on that note, they would not continue, especially if the reaction was very severe. But other than that, then yeah, you should take it.
Get your vaccines, right?
Yeah, and just to bounce off that as well, we know that there are always going to be a small pocket of persons in our population who can't be immunized for whatever reason. We have what we call a target. So if 95% of persons in a community are vaccinated, then that produces what people like to talk about herd immunity, right? So if we get vaccinated, the majority of us to protect those who can't be vaccinated, right?
And we're not heading towards the point where, let's say, we need to vaccinate children for, let's say, COVID. That's not mandatory, right? That would be a choice by parents?
Yes. So COVID is not mandatory. That is by choice.
And let's say there's someone out there who, they don't know much about vaccines. They might be skeptical. They may feel as though it might be harmful. What's the science behind it that gives them a peace of mind? Or what can you say to somebody who may not know about the science of vaccines that just describes how they work?
Okay, so definitely to look at trusted sources as well, because there's so many websites out there. People go and get terrified. So you want to look at sources such as we're under the Pan American Health Organization, PAHO, PAHO. You can look up PAHO vaccines, frequently asked questions. But in a nutshell, what they'll find is that the same germs, the viruses and the bacteria that we're exposed to in the vaccines are the same that we're exposed to every single day. And this just allows us to be introduced to it in a much safer way.
There you go.
Right?
And keep that measles, mumps, and rubella out of here,
Far
right?
away.
I don't even know what rubella is.
Let's not find out.
That sounds like somebody I know from around the corner, right?
Long time ago. But the other thing to that too is the vaccines are the same that we would have taken. So I was born in the 80s. Some of us in the 70s, some of us in the 60s, and they started giving vaccines from back then. And so it has not changed. Now we have some newer vaccines out, like, we give people something that's called meningococcal that prevents an infection in the brain or certain pneumonias on the chest. But the things like the polio and the measles, they've been around for years. They have not changed. And so if they protected us back then, they're still good enough to protect your children today.
And I'm sure by now there's long-term studies that have probably been done to see the outcomes for
certainly
folks who took their vaccines in the 60s, 70s, and 80s. So like you said, find trusted sources and look up the information. You can check PAHO's website. So if somebody is watching the show and is like, I need to get my child vaccinated, what should they do? Where should they go?
Okay, so for persons who utilize the community clinics, you just want to visit the clinic that's nearest to you. If you have your yellow card at home, you can take it with you. If you don't, that's fine. You can go take your child and let the nurse know that you came for the immunizations. We do have an electronic platform now, thankfully, where we are able to see if you got a vaccine in Anagua and you're in New Providence, so we're able to see that you got that in Anagua and bring your immunization record, the card itself, up to date, or to see what it is that you're actually missing. There are persons who have taken advantage of NHI, and so those physicians also provide immunizations. So you can actually make your appointment with them and go right ahead. If you have any other questions, the National Immunization Unit, you can contact us at 341-1741 or 3, and I'll be happy to answer any questions that you have.
Fantastic. I learned so much this morning. I get into Anagua for my vaccine. That Anagua vaccine sounds good. We'd like to thank you all this morning for being here, sharing your information. We appreciate the work that you do and continue to keep the herd immune, right?
Yes.
Thank you so much.
Yes.
Thank you so much for being on the show this morning.
Thank you for having us.
You're watching Mamas at Sunrise. We'll be right back.